You're listening to Health Professional Radio with Wayne Bucklar. Joining me today, my guest is Dr. Brian Muller. Brian is the Medical Affairs Director of Mundipharma. Brian, welcome to Health Professional Radio.
Thank you very much, Wayne.
Now, Brian, tell me a little bit about Mundipharma, because it's not a name that immediately sort of says what it is you do.
Yes, Wayne. Look, most clinicians would know Mundipharma for our pain portfolio. But we've certainly grown and we've diversified in recent years, and we've focused on other areas now. And that includes oncology, respiratory, ophthalmology, and also over-the-counter products. But over and above our products, we also supply services to the healthcare industry. We've got a medical information department which provides accurate and up-to-date information to both patients and healthcare professionals. We also deliver accredited medical education programs to healthcare professionals, and we also support studies which are initiated by researchers in academia. Now, all these programs focus on instilling best practice in the management of patients, and they also include practical resources to support the day-to-day activities in medical practice.
Now, Brian, I notice on your website that you speak extensively about the quality use of medicines. How does that figure into the Mundi philosophy, the Mundipharma philosophy? Yeah, well,
the key services we provide is to educate healthcare professionals, and our educational programs are updated regularly. They provide valuable, objective information for healthcare professionals to choose the best available option for their patients when prescribing. And that quality use of medicines that you refer to is the cornerstone of Mundipharma's philosophy and practice. It's embedded across every aspect of our business. Patients come first in everything we do. We're committed to ensuring the best outcomes for individuals and communities and the healthcare system as a whole. And this provision of high-quality products and services helps all Australians to live well and age well.
And that's a very admirable ambition to have. Now, Brian, in implementing that, you talked a little bit about the research that you do. That's an extensive part of what you're doing, isn't it?
Look, we do our own internal research, but importantly, we also support what's called investigator-initiated research. So these are independent trialists out there in the academic world who come up with their own ideas in terms of what research should be done, and they approach us to support them with funding or any other means of support that they may require.
Yes, that's an important thing to happen. I think we quite often have academics on the program here with us, and quite often funding and in-kind support is one of the things that they desperately need to get their work across the line as well.
Yeah, correct.
Brian, Mundipharma is not an Australian firm, it's a multinational firm, am I right in that?
Yeah, look, Mundipharma has been around since 1952, and it operates on 6 continents.
Uh-huh.
But locally here in Australia, we're pretty much a medium-sized pharmaceutical company. But interestingly, we are part of a network of independent associate companies. Now, what that means is we have that independence to be agile and adaptable. And really, we can quickly respond to the needs of prescribers and patients as a result of that. So, yes, it's a pretty unique setup compared to Big Pharma.
Yes, it does sound different. I have to admit, I haven't heard of other companies structured that way in the pharma business, but I guess they're around. Do you differentiate yourself from Big Pharma in other ways?
Look, we really, because we're small and because we have that ability to be agile and adaptable, we're very close to the customer. We operate in a very similar fashion to the big pharmaceutical companies, but I suppose we haven't got those layers of approval on top of us. So really, I think we can be more reactive. I've worked in big pharma as well, and for me, that's the big difference.
Yes, certainly with some of the multinational pharma companies, it is, as always, bureaucracy slows things down, and I think that happens probably in every business. Now, Brian, About 95% of our audience are clinicians of some kind or another, mainly in acute care or in aged care. Is there a takeaway message that you'd like them to get today?
Look, I'm a practicing clinician myself. I mean, I was a full-time clinician for over 13 years once I finished my fellowship here in Australia. Mm-hmm. And since I've been in industry, I've always maintained an attachment at a private hospital. So I've never stopped seeing patients, and I understand firsthand the concerns that clinicians may have around the prescribing of Schedule 8 products. Mm-hmm. You know, I think there's a genuine concern out there with regard to these products when it comes to things like, the potential risk of addiction or abuse when prescribed inappropriately. What, I've really got to respect really is the fact that when prescribed appropriately, we know that these products can be a real game changer for patients in alleviating pain, improving function, and significantly improving patients' quality of life. And, I think, as a clinician myself, I think the well-being of patients needs to remain our priority. And, we shouldn't be reluctant to prescribe these products where appropriate.
Yes, I think that's a very good message because, as you say, they are very effective when they're used appropriately. Brian, my favourite question in every interview has to do with misconceptions. And I guess in every industry and for everyone there are misconceptions. What's the biggest misconception amongst your customers, clients, patients in your work that drives you nuts and keeps you awake at night?
Look, I think at Mundipharma that is the biggest misconception, the one I've just touched on, the prescribing of Schedule 8 products. I don't mean to be repetitive, but that definitely is our biggest issue. We've conducted research, external research, so that is independent of us. We've supported this, and the study suggests that if the appropriate drugs in this therapeutic area are appropriately prescribed, that misuse and abuse can in fact decrease. And we know also that from direct feedback from clinicians, be they oncologists or pain specialists, we know that appropriately using these products can significantly alter, how a patient operates and, their day-to-day quality of life.
Well, let's hope today, Brian, that at least with our audience, we've raised awareness with a few people about that issue and the prescribing of Schedule 8s appropriately. Can I just check with you, for people who want to get in touch, is the website the best way to do that?
Yes, or directly through to our medical information department. So that's just phoning the main switchboard number and then to ask for medical information. And we have subject matter experts who are dedicated to the various therapeutic areas.
And that number, I'm assuming, is on the mundipharma.com.au website?
Correct.
And because I always get into trouble for not giving listeners enough warning to get their pencils out, that was www.mundipharma, MUNDIPHARMA, mundipharma.com.au. And you can find there the phone numbers for the switchboard and the information service associated with it. Dr. Brian Muller, Medical Affairs Director of Mundipharma, thank you for your time today. I do appreciate it.
Thank you, Wayne.
If you missed my conversation with Brian, the good news is we've got a transcript on our website. We also have a recording of the conversation in both SoundCloud and on YouTube, and you can access all of those through the station website at www.hpr.fm. You're listening to Health Professional Radio. My name is Wayne Bucklar.